Hi, my name is Diana and I'm going to be demonstrating on how to use the Hoyer. So when you first start, make sure that the bed is at hip level. That way you're not bending over and hurting your back. And you want to make sure that the patient is dry, which she is, and make sure that they're fully clothed and she has her pants on. So we'll go from here and get her sling on her. Ready? Okay, Frances, we're going to roll that way, okay? Okay. Make sure her pants are pulled up and her shirt's pulled down, that way the sling doesn't rub on her back. And then you're going to want to take the sling, and I always kind of roll it a little bit like that, and then you tuck it. And to know how far you need to go, you can always bring this up, and if it lines up like that, then you know that you have enough on the other side. Okay, Frances, roll back this way. You okay? Alright, come see me. Again, make sure her pants and shirt are pulled down. It prevents sores. And with this half sling, you're going to want to go under her legs like this and make sure that it's not wrinkled or anything, because it'll cause pinching and they can get sores in their legs. And then when you have it up, you cross it like that. And then she's ready for the lift. You wheel the Hoyer over the patient, and you want to make sure that there's a little release down there. You want to make sure that that's locked. That way it doesn't come down anymore on the patient. When you're getting them up and you're sitting them in the wheelchair, the best is to get the closest color to them on the top of the Hoyer. So that would be green on the sling. And half slings have side ones that you want to do. And I do green on there because we did green on top. So you kind of want to get close with these two, that way the patient is in. They're cradled. And then you do the last color on the bottom, that way they're sitting up in an upright position, and so it's easier to pull them back in the wheelchair. On this lift, you grab that lever and you pump it up. So go ahead, Joanne. And make sure you tell the patient to keep their arms inside. That way they're not getting pinched and they're not hanging on up here. And you're going to want to support their legs as she comes off the bed. That's as far as it goes. You're going to want to grab these back straps back here to help wheel her over to the wheelchair. And you open the legs, back up a bit. And push the wheelchair up to her. And then you grab right here on the sling. You don't always want to grab down here anymore, because as she goes down you might pinch your fingers. So you want to grab right here, and Jolene will hold her legs, and then you slowly release that lever down there. You don't want to go too fast or you're just going to like slam her in the chair. You want to make sure her feet are out of the way so she's not getting pinched and her feet aren't hitting anything. And as you come down, make sure that you don't hit their head. You can even ask the patient to move their head back.
Thank you.
And then once you have enough slack in the sling, you can start taking them off. I always push it up and away from them as they pull it back. That way it doesn't hit the resident at all. And with these straps, you can just go ahead and tuck them in, that way they're out of the way. But be careful where you tuck them because they could be sitting on them and you don't want pressure sores to start. So these bottom ones, I just kind of laid over their lap.